Happy Friday morning, Wakefield and beyond, and welcome to our weekly COVID-19 update that we've been doing for a while now. Joining us today are our usual suspects, including Superintendent Doug Lyons, Chair of the Town Council Ann McGonigal Santos, Health Board member extraordinaire Laurel Global, our health agent Ruth Glay extraordinaire. Who else am I missing in? Superintendent Doug Lyons, maybe I said that before. Jen McDonald, our communications director. And those of you from the public that are in there, I welcome you as well. Thank you so much for joining us. Let me start what we always do. And if we could put the graph up there, Ryan, on where we are in our case counts. Thank you very much. Thank you. Wakefield, as you know, is the bottom there, is trending much better. Every week we're going down. In fact, last week, my numbers show, which is always a little bit off from the state, I'm counting 74 new cases, which is still too high. Our numbers are still too high. We're still in red, but we're trending down. 5.46% positivity this last 2-week period. 2 weeks before, it was, our last week was 5.59. So we're getting better, we're doing well. So Wakefield, I'm going to ask you to still keep vigilant. Keep going, do what you can. Please wear a mask. Do all the things we've been talking about. We are beating this back slowly but surely. It is a long slog. It's not a sprint, it's a marathon. So let's keep that going. Why don't you show the map, if you don't mind, Ryan? So you can see the map. We have a few communities around us, but overall the state is getting better. I'm really hoping that next week I can be singing the Yellow song. So let's keep going and doing that, Wakefield. But as you can see, I think there's probably 30 or 40 communities statewide that are no longer high risk. And I really challenge Wakefield to really stay safe and stay strong and do all the right things to get us in that section. So you can get rid of that. I don't want to look at that anymore, Ryan. Thank you. I saw that Tom Walsh, our emergency management director, joined us as what? Let's talk about something that's much more exciting and really is our first attempt, and a wonderful attempt in fighting back this virus. Through our public health consortium with the communities of Melrose, Malden, Medford, Winchester, Stoneham. Did I miss anybody? And Wakefield. I got everybody, Ruth. We were able to hold a very, very successful clinic on Monday, February 1st, which was the first day that those, according to the state guidelines, that those 75 and older were included in the mix. We had a long day that was threatened by snowstorms. We had to not only set up that clinic, but pivot very quickly to expedite it. So we kept our, really more of our vulnerable people out of the snow. And I'm going to say that it was a very, 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 very hugely successful day. I thank all of the volunteers. Here's our first person in Wakefield being vaccinated. What a wonderful woman she is. Jen, what was her name? I forget. My mind is a sieve.
Leonora Murray.
Leonora Murray was there first thing, and you can see her smiling under her mask, and what a lovely picture, and so happy am I to be a small part of this whole thing. My heart goes out to all of the volunteers that were there all day, many of them from, and many days before setting up, but they're all day really from before 7 until close to 9 o'clock at night. Certainly Tom Walsh and Ruth Clay, yeoman's work, Laurel Global, yeoman's work. I don't think any of us sat down for 14 hours that day, but it was well worth it. And with the numbers and everything, I'm gonna turn it over to Ruth. Ruth, go ahead. You and Tom are the stars. Go.
Thank you. Thanks, Steve. Yeah, my first number is 7. I walked 7 miles that day, all within that building. Yeah, it went really well. Really want to thank the owners of the building for letting us use it for free, which is a huge help. And it's couldn't ask for a more ideal site for holding a large clinic. Everybody who helped were just so friendly, helpful. The comments have been so positive. Police department went well out of their way to help people, wheel people around, walk people out to their cars, just super. Firefighters with the EMTs also, everybody. It was really a very positive community feeling event. And for a lot of people, the social event of the year, since we all got to see people we hadn't seen in a long time, which was really nice. So we did immunize 1,484 people. 1,484, which is huge. And as far as I know, the largest day of immunizations anywhere in the state, and way above what the mass vaccination sites are doing. So,
To
yeah.
put that in perspective, Fenway Park was bragging about how they did 500 on
Yep.
that same day. Doubletree in Danvers opened up with a soft opening. There's nothing soft about this group here. They were going to do 400 that day on their soft opening. We did 1,484.
Amateurs.
Maybe they're much smarter than we are. That might be what it was, but really, God bless all the people that worked all that day, just really nonstop from whenever. I didn't want to jump in, Ruth, but I think that needs to be highlighted.
Yeah. We, of course, are getting a lot of questions about what next. And we are still in the first group of phase 2, which is 75 and older. We will be holding a clinic towards the end of February that will be only people 75 and older who live in Wakefield. So we need to have, we're really at the mercy of how much vaccine we get. And this, I'm not blaming the state, because the state is at the mercy of the feds. So, you know, we're the trickle down, we're at the bottom, but because we're a region, we're getting more vaccine. Other communities that are not in a region are getting 100 doses a week. I'm not sure what you do with 100 doses a week. We get more than that, but we're sharing it again with 6 communities. So we will be doing clinics in all 6 communities towards the end of February. We like to have the vaccine, as much vaccine in hand before we announce dates, because I know of other communities who have scheduled clinics and then not had their vaccine. And I don't want to be one of those. So, but rest assured, we also are working with the Housing Authority. The state is doing a separate category for them and have sent out surveys to them. We will do the Housing Authority people once we're given the vaccine for them. I believe that will be the beginning of March, but the plans are in place. The state's gathering the information. We'll get the vaccine and then we'll give it, of course, to them. So, you know, it's one phase at a time, well, one section of phase 2 at a time. I know there's a lot of people, including the teachers, who are very anxious to be vaccinated, and we're anxious to vaccinate everybody too. And as we get vaccine in, we will do it. And I also wanted to do a shout out to Melrose Wakefield Hospital, who is storing our Pfizer vaccine, which is very temperamental and needs the ultra frozen storage. And not only are they storing the vaccine for us, but their staff is basically becoming technical advisors for us when we have questions for using the Pfizer vaccine. So this really has been and is and will be a huge collaboration. And the community has been coming out in droves, signing up. Again, if you want to volunteer, there's a form on the town's website on the homepage that you can complete. And Rick Stinson, our volunteer coordinator, will hook you up. Even if it's not right now, once we really get rolling and get a lot of vaccine and start doing a lot of clinics, it takes a lot of volunteers. We had almost 100 volunteers on Monday. So it takes a lot of people to run these clinics. So if you're interested, please go to the website. For February, from what we've been told from the state health department, we'll do that one over 75 clinic. It certainly will not be enough for everybody, but it will be a start. And as we continue to get vaccine, we will continue to hold the clinics.
Right, thank you. And one thing I'm going to say to the community out there is that if you are, a community in Wakefield and you are over 75, if you want to wait for the clinic in Wakefield, absolutely do, but you don't have to. You can go to any of the state clinics. So I know that's difficulty, but don't necessarily wait for us. Try to get on to the other ones, because that is, you can go to any of the state clinics. So.
And some of the primary care physicians will be starting to vaccinate also. So I think, Steve, that's a really important point. Check with your primary care. There are some pharmacies that are offering it, not in Wakefield, but there are some. If you go to that map, you can go to any site that's green or red. Red is a mass vaccination site. It's a red star. And the green is open to the general public. And the greens are normally like pharmacies, places like that. Not the yellows, not the yellows.
Not the yellows, no. Thank you, Ruth. Tom, our emergency management director, pulled this all together in 10 days with everybody's help, but he was unbelievable, is unbelievable.
No, it was a very successful exercise, but I want to mention that just on departments, IT, DPW, public health, HR, the town administrator, you can take a bow, police, fire, council on aging, the staff coordinator we hired, which was Rick Stinson, and of course, Jen McDonald, our communications. All those people, they were all an integral part of our successful campaign there. Without everybody's help, we couldn't have got it done. So kudos to everybody else. And we're going forward. We've already had our meetings of how to just improve a little bit, with maybe some small deficiencies we've found, and we'll correct them as we go forward and continue to do our exercises on conducting these clinics.
Perfect. Why don't I switch over to Laurel Global first? She was there all day, all weekend, all day, Monday, Saturday, Sunday, Monday.
Yeah. So, again, we've been together now through 2 pandemics with Melrose Health Department and Wakefield Health Department. We're all good friends. I think this model that we have, where we've worked as a coalition with the 6 communities, is quite a demonstration of cooperation and effectiveness. Having a partner at Melrose Wakefield, and we call the pharmacist just one more time, because I have never worked with such dicey vaccines in my career, but I think we have finessed it. I got to thank all the nurses and other volunteers who came out. I'd say, in case no one knows this, but long ago, we started emergency planning and invested in all sorts of colored vests. So we are calling the medical team the red vest team. Support is white vest. Leadership is generally yellow. Sometimes we use orange hazard vests. We're starting to think about hats to bring out some leadership, but got all great comments from the nurses and vaccinators who helped us. The EMTs were fabulous. It really was quite an impressive community effort. I do not want to put us through that goal of vaccines that we ever did again. I think there is some wisdom in slowing down sometimes. So it's kind of like the person who gets perfect attendance, but they kept coming to school sick. So, we don't, we don't want, I am not going for that award. I'm going for accurate and fair. And we have figured out some idiosyncrasies in the vaccine where we can control things a little bit better. But, I'm so impressed, and I'm so impressed with the efforts that we've been able to do. And the building was, it's funny. I thought the building was way too long, and then I realized that it needs to be that big for social distancing and keeping it safe. I just want to remind people that if they happen to get COVID symptoms between the first vaccine and the second vaccine, to please work with us about getting out of isolation, because we don't want, you don't get the effective vaccine until 2 weeks after the first vaccine, and then you're not fully protected until the second. However, if you run into the virus, we need to go right back to treating you for COVID and keeping you safe, but also in isolation. So just an important point, but thank you, everybody. Incredible job.
Hugely important point, because I think a lot of people feel that, oh, I got the shot, I'm ready to go, right? And that's not the case, people, not the case. It's got to run through its course, and you've got to get the second shot, and that's got to run through the course as well. We are really blessed to be supported by not only a great town council, but an absolutely fabulous chairwoman. And our chairwoman, Ann McGonigal Santos, is on for a few words of wisdom this morning. She's joined us about every week too. Even when she had COVID, she was on here.
That's right. I just want to thank everyone from the town council, myself, the bottom of my heart. All of the volunteers made what sounds to be an incredibly successful clinic. I think what Laurel had alluded to is, I remember when we battened down the hatches on the H1N1 in the forethought that there could be something else happening similarly, I think allowed us to be prepared. Probably because we have Ruth and Tom, but better than a lot of other communities. And I think Steve saw folks from other communities who are desperate, and it's heartbreaking to turn people away that didn't fit the criteria. But I really do, I don't know that Wakefield residents understand how lucky we are for the team we have, that we can roll this out in a national and state rollout that has had its issues. So I just want to thank everyone I was not there, but from what I've heard, the volunteers were just phenomenal. So thank you all.
They were phenomenal. One thing that the town council, and really all of us, but particularly the town council and Chair Santos, is we really are very concerned about our population that can't use the computer, that can't sign up. This is a very difficult, well, it's not very, it's difficult to go through if you're not computer savvy. You got to fill a lot of forms, you got to do that. So I will say that our Council on Aging, Judy Luciano and her staff, absolutely fabulous on helping you out and getting you in, as was the health department. But they were focusing on some issues, and probably better to call the senior center and Judy Luciano's staff if you have help, if you need help on getting on. And that number is 781-245-3312. That's their main number. We may have a hotline and different numbers later, but that's a number to go through for them. You can talk to Judy and her staff, and they'll be great to help you out when we do have future clinics and what have you.
Steve, can I just jump in for one thing? Because in 40 minutes, the governor is going to announce a statewide 211 helpline that will provide the same services. So if you're over 75 and have difficulty or don't have a computer, you can call 211 and they will register you for an available clinic. And if there is no available clinic, they will keep you on a callback list to call you when there is an available clinic. So again, that's hot off the press. It will go live at 11:30 when the governor makes his announcement. So that is another resource.
That was going to be my next point, but Ruth jumped in and beat me. That's quite all right. We will have that information on our website And on our website, Jen, why don't you talk a little bit about the tutorial?
Sure. So the state's website is, you know,
Challenging.
It's challenging. Thank you. Are we live? It can be challenging, and there are a lot of folks who, aren't super tech savvy. So we put together a tutorial that just runs through the process of where to click and how to click and what to look for. It might be helpful. I happen to be there. I put the link in the chat, and it's on our site. I was there on Monday, and there were so many folks who said, my daughter signed me up, my neighbor signed me up, my grandkids signed me up. And so that was really nice to hear. So if there's someone in your life that you think might need a little help, it's frustrating for all of us. I kind of likened it to trying to buy really good seats at a show. You just kept refreshing and I hope something pops up. It can be really frustrating for those that are not tech savvy. So, if there's someone in your life that needs a little help, reach out. There are new appointments being added to these, like the Danvers Doubletree. Like Ruth said, when the vaccines come in, they do add appointments. So if you find you don't see something today, check again tonight or tomorrow.
It is constant vigilance if you can do it, which is too bad, which is tough for some people. But I'm thrilled that the call center is coming out, and Wakefield again called, and we have you on a list. We'll try to add you as we go, as we get more. Doug Lyons, state of the schools.
Thank you very much, Steve. Just a little bit more of a context for the vaccination clinic. On the school side, excuse me, on the school side, we have 3 groups that recently just interacted with the vaccination clinic. We had some of our faculty and staff that volunteered at the clinic. We have a large number of teachers who grew up here and live in town, right? And we had a portion of our faculty that were vaccinated, but we also had a portion of our faculty that brought their parents that live here in town to the vaccination clinic. So we have, 3 groups that were positively impacted by the vaccination clinic. And I just want to make one note about the leadership team, right? And so it's very difficult to lead during these times, right? Every decision you make is scrutinized, and it's difficult. The leadership group, Ruth, Tom, and Steve, they were there for the entire time that the clinic was open, right? And that's what, from the outside looking in terms of modeling, that's leading from the front, right? When people tried to sneak into the clinic and they didn't belong there, there wasn't someone else telling them they shouldn't be there. It was Steve Mayo, right? And so, and I didn't
Thank you
hear,
for pointing that out. Now they know who I am.
it's interesting because this was reported back to me from some of our teachers that were just found some time to volunteer at the clinic to say, like, these guys were not fooling around. But there's really something to be said in terms of modeling and leadership, from leading from the front, right? And the other part that we didn't mention around Fenway only gave 500 vaccinations. They closed, right? So, the mass sites just closed because of the snow. Wakefield did not. So for that, I think I'm grateful to be with this group and to kind of have this leadership group supporting our faculty and staff. I would be remiss if I didn't say our teachers are very ready to get vaccinated. So I'll leave that there. Just an update on cases. We have 20 new cases, 20 new positive COVID cases, 18 students and 2 staff members. We tested this past weekend, we tested 77 faculty and staff with 1 positive case. And so that's very positive. Just a very quick update on pool testing. We have kind of reviewed the opportunity that's being rolled out from the Department of Elementary and Secondary Education. We scrutinized all of the literature. We went through the data. We kind of convened as a group with our school nurses. We looked at the Association of School Nurses and their guidance. And after reviewing all of the information, we feel like in the Wakefield Public Schools that to start pool testing at this point in time, in terms of a cost benefit analysis and the resources that it would take to invest in that, and how it would intersect with vaccinations. And it would also interrupt the testing that we're doing on Sunday. We really felt like it wasn't the best direction for us to go at this time. But that's it from us. If we can help in any way, please let us know. Other than that, thank you very much.
Thank you. And I also want to again thank the volunteers. Really, a lot of them were there all day too, from the nurses to the administrative people, inputting people, pushing people in wheelchairs, going out to people's cars and helping them get in. Police, fire. I mean, really, so proud to be part of this team and the community. And I think we talked about it was the social event of the year. People were really enjoying themselves, probably too much in the beginning, because what we did is, in seeing the snow, best laid plans, right? People had appointments spread out all during the day. It should have been a very even flow where people followed the appointments. Well, that didn't quite happen with the snow. We actually contacted people telling them to come in earlier so they would beat the snow. We didn't want our older folks out there driving in the snow and what have you. That was what the tack that we took, and it worked. It was a little frenzied, but it worked. Others decided to close up, but they made their decisions, we made ours. So again, I am thrilled. I am thrilled with the community's response, thrilled with the help. Please stay tuned to the website. Stay tuned to the governor's announcements. I guess that's in 33 minutes now, 11:30, about the new call center. And if you have any questions, please call here at Town Hall, Senior Center. We're here to help you. Anybody else have anything to add? No? I hope everyone has a wonderful weekend, particularly this group here. I hope that none of you are at our vaccine site this weekend because there's nothing to do. Right, Tom? You staying out of there this weekend?
No, I have to take care of some things, but it'll be just a slow day.
Okay, all right. Well, call me. I'm happy to join you.
All right.
Okay, all right. Again, stay safe, Wakefield. Let's get into the yellow next week. Let's really do what we can and pay attention to the website, to social media, to the Wakefield item, to WCAT for any updates. Great. Have a great weekend, everybody. Thank you.